Thank you, Dr. Neha Kakar and Sahanisa. Good evening, good afternoon, and good morning. This is the 1457th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session. Today, our guest is Dr. Beatrix Gessner from Germany. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, we are about to reach our fourth year on 30th of August. That means just 3 days away from the celebration of fourth anniversary. And we have a wonderful guest tonight to have the session from Germany. As you know, the International Forum has different doctors from 65 countries participating every day. And we have sessions in different language also. We have 3 sessions every day, 7:30 to 8:30, the Hindi session that is just over 8:30 to 9:30, the international session in English, and 9:30 to 10:30 local language session in Malayalam. And today our guest is Dr. Beatrix Gessner from Germany. She has completed her MD in dermatology and is a medical doctor from the modern field of medicine. And she is an ardent believer and follower of a homeopath, and she is practicing homeopathy for the last 36 years. She is specialized in dermatology, pediatrics, and general medicine, and practicing homeopathy for the last 32 years, and giving seminars in different parts of the world, and particularly in the Portugal for the last 10 years. And she's one of the regular coordinator from Germany, and she's always there in our forum giving lot of presentations, and all the presentations were really excellent. She's the person who always give the biography and everything about Dr. Hahnemann and what is the present situation in Germany of all these things were discussed in this forum by this great doctor Beatrix Gessner from Germany, and she is having a very good practice. Also, she has cured lot of cases with homeopathic medicine in dermatological conditions in different, and she has shown some of them in our forum also. So let us go to the subject. That's homeopathic treatment for skin disease. Part 6 is the thing to be discussed here. We welcome you, madam.
Thank you so much, Dr. Danish, for your very, very kind words. It's always a pleasure to be with you. And as you know, I like to show practical cases. Today we will have part 6 of dermatology. And well, let's start with the slides. Okay.
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 It's fine here.
It's fine. Okay. So that's today. IFPH, Homeopathic Treatment of Skin Disorders, Part 6. And generally, I would like to say that the treatment of severe and chronic skin diseases is one of the challenges in our homeopathic practice. Patients with multiple allergies, strong itching episodes, and recurrent skin eruptions are undergoing an immense discomfort. Children with atopic eczema often affect the well-being of the whole family, with sleepless nights, difficulty of nutrition, and despair of recovery. Fortunately, we can offer a successful therapy with our homeopathic treatment. To avoid the administration and suppressive therapies like corticosteroids is one of the most important issues during the cure. The homeopathic remedies have to be adapted to the acute conditions and the chronic disposition of the case. So once again, the homeopathic remedy has to be adapted to the acute condition and the chronic disposition of the case. And this is the kind of art with homeopathy, to take the right symptoms at the right time. Okay, first let's talk about the function of the skin, which is very special. The skin, perhaps we don't believe, but the skin is the body's largest organ. It serves many important functions, including protecting the body against trauma and microbes, regulating the body temperature, maintaining water and electrolyte balance, and sensing pleasant and painful stimuli, and also participating in the synthesis of vitamin D. So we have a big range of very different capacities of this organ, which we call the skin. So every 28 days, the cells of the epidermis are totally renewed. That's the cycle of the moon also, every 28 days. In this process if this process is accelerated, we can see horny skin modifications like psoriasis. With psoriasis, for example, the skin turnover can be down to 5 or 4 days. So it's so quickly, and that will produce that well-known scabs of the psoriasis. Okay, if we look at the anatomy, we have 3 layers. We have the epidermis, the dermis, and the subcutis, the hypodermis. The epidermis here is the layer most outside, protecting us against the influences from outside. In the dermis, we have a lot of different organs. We have blood cells, we have nerve cells, we have the hair, we have the sweat glands. So this is a very differentiated layer. And one layer more low, we have the subcutaneous layer, which is with fat and going to the muscles. Okay. The functions of the skin, we have the excretory organ, and it's like perspiration or discharges, milk rust, that's excretory. And also the skin is working as an immune organ. This makes sense because it's our outside layer of our body. So we can have IgE transmitted reactions, we have mast cells, all these cells are within the second layer, which is called dermis. And it's also a contact organ. So interesting also to know is that when the embryo is developing, we have 3 main layers: ectoderm, derm, mesoderm, endoderm. And brain and the skin have the same layer, the same cotyledon, which is ectoderm. So the brain is formed by the skin and folded inside. So that also can explain that the skin and the mental or emotional sphere are very much connected. So the psychological part of skin diseases is very prominent. And in Germany, we call that allergic disease, which includes the neurological or psychological part. Here, with neurodermatitis, our homeopathic remedies are the first choice because they cover the physical and the emotional sphere. And the skin is also a reflection of the soul. So in Germany, we have a lot of these patients, also a lot of children. Incidence, it's a modern pandemic here in Germany. The incidence of allergic eczema is about 15%, and of atopic disease between 20 and 30%. So if we treat these patients, we want to help. We want that they are better. We want that they have a release. But the main issue is in skin diseases, especially in allergic skin diseases, is not to prevent any suppression. That means to prevent that they will take a lot of cortisone on the skin. Because as we know, this can give a shift inside the body, going to the lungs, going to the intestines. So mostly also the parents come to my office, to my clinic, and ask, please, we went to the children doctor and he gave us ointment of cortisone. Please, do you have another choice? So we also have rubrics of suppression. Asthma eruptions after suppressed. No, asthma after suppressed eruptions. That's the rubric. And we have apis, but also arsenicum, soranum, pulsatilla, sulfur. Or we have the rubric asthma alternating with skin eruptions. Here our big remedies are arsenicum, causticum, graphitis, ethereum, soranum, sulfur. Yes. And talking about the allergies shortly, we have two different types. We have the early type, which is PPE mediated. It comes directly. The child is eating something and it gets redness around the mouth, or it gets um, exacerbation of the eczema. So this comes after food or taking drugs or also with pollen. And we have a second type, which is a late type. And here it's triggered by T lymphocytes. And these T lymphocytes take a few days. So here, because the T lymphocytes are inside the skin, they will produce pustules, nodules, a vasodilatation, kind of contact dermatitis. So this is a different form of allergy. Very important, the allergy tests with the children, they are not specific. In the first 3 years, they are unspecific. They don't count so much. What is counting is the experience of the parents. What kind of food the child is tolerating and what kind of food not. And we also have the possibility by, we call that biotens, little machines. They can measure the waves. This is also not so bad, but the blood tests, e.g. blood tests, they don't work. So very important, no fixation on the allergen as a cause of disease. Oh, if my child will not take any more milk, it will be healthy again. If the child will not take any more sugar, it will be healthy again. Sometimes it's like this, but very rarely. The disease is or the disturbance is at another level. So a German, very well-known German medical doctor and homeopathic doctor stated one day, he said, skin diseases rarely have external causes. The appearance of the skin is a visible reflection of the internal pathological change. In other words, an allergic eczema is not a skin disease. It comes from inside. So causa, the causa is multifactorial. It can be environment, nutrition, it can be genetic, it can be psychological, emotional, and all these different points come into the choice of the homeopathic remedy. So with my skin patients, I really like to work with LM potencies. I already did give 1 or 2 sessions about LM potencies. Dr. Danish knows that I like them because I like them very much because we can control very well. And within 1 week, I can see whether the remedy is right or only a bit right or not right. So, and we have very little first reactions, which is very, very important if we treat these children with allergic eczema. And what is also very, very helpful, that we can give homeopathic LM potencies together with allopathic drugs in our patients who are with difficult diseases, with autoimmune diseases, and which are needing at the moment still to take these allopathic drugs. So as a dosage, I normally use 30 milliliters bottles. I put some globules inside, I put some water inside, and in light cases, I will give 5 drops daily. In medium cases, twice, 5 drops daily, and in severe cases, twice, 10 drops daily. And I will explain with the cases to be practical for you. So, if normally I let the patient take the remedy for 1 week, no doubt, 1 week. And if it is not better after 1 week, we have to change the remedy. If the patient is better after 1 week, we stay with the remedy as long as he is improving. If he's getting more better and better, we have to reduce the dosage to give less. If after a phase of amelioration, the situation is getting worse again, it can be an overdose, and we have to make a pause, a break. So C potencies in chronic cases. C30, we have to wait and observe 4 weeks, as Dr. James Taylor Kent told us. And with C200, we have to wait and observe for 6 weeks. So I prefer LM potencies with allergic eczema or neurodermatitis because I can decide much more quickly whether we are on the right way or not. So now let's talk about the clinical cases. Case 1, it's a pustulous eczema. A little child, more or less 1.5 years old, has this pustulous eczema since 4 weeks. This girl, 1.5 years old, eczema since 4 weeks. And the parents, they went to Poland because the mother is from Poland. And they said, oh, our child did drink a lot of milk over there. It had a lot of mosquito bites. Perhaps this was causing the pustules. And my colleague, my pediatric colleague, he was giving sulfur C30, and the situation became much worse. So she did send the child to me. And what happened? First, the child was very difficult to examine, did not like to be touched, did not like to be looked at, was crying, saying, no, no. The child did not have any fever, but had a kind of coryza with an albuminous discharge and was waking at night, very often at 3 o'clock, with itching. The times at night of itching, if they are more or less at the same hour, are very helpful for the repertorization and to find the remedy. That is my experience. So if you look at the repertorization, we take cannot bear to be looked at, aversion to be touched, worse at 3 a.m. at night. I also did put in milk, aggravates, but this was not that sure. So I did take The child was very lean constitution, and I did take pustules and the nasal discharge. So we see natrium muriaticum, arsenicum album, calcarea, silicea, nux vomica. And as the parents are also a kind of homesick, they're living in Germany, they like to live and work in Germany, but still feel connected with their country in Poland. I found that natrium muriaticum would be a good choice. So I started with natrium LN4, twice, 5 drops daily. Also, as a local treatment, they got wet compresses with vinegar water that is a bit disinfecting. Vinegar water and no milk at the moment. 4 days later, at the telephone. In the beginning, a bit more restless at night. Face a bit better. Legs are the same. So we don't know really. 1 week later, after 10 days, more or less, sleep is a bit better, legs are a bit better, but still a lot of pustules. So if we hear this, we don't feel the remedy is doing something, but not really helping in a strong way. After 10 days, it's not worse, perhaps a bit less pustules. But what was good is the child did not have any fever. Now we see, sorry, but it was so difficult to make a photo because she was moving all the time, but we see still redness and she still has pustules in that face. So they came again and the father said, now she developed a panaritium around the nails. And this is an old symptom in her. This is a bit strange. A little girl, 1.5 years old with panaritium. And the father said, yes, and the skin is not healing very well with my daughter. Okay. The feet are cold and wet, still itching around 3 o'clock, still does not like to be examined. So I did repertorize again, the same rubrics, cannot bear to be looked at, cannot be to be touched, 3 a.m., lean constitution, pustules, unhealthy skin, and panaritium. And if we take these symptoms together, silicea comes to the first point, and as silicea has more tendency to produce pustules than natrium muriaticum, I changed the remedy. So silicea, LM1, twice daily, 5 drops. 4 days later, at night, she's much calmer, less redness, less pimples. So now, after 4 days, we feel something is really happening now. She's much calmer at night. Okay, we go on with the same treatment. 1 week later, she's more relaxed. She feels much better. The sleep is much better. And the pustules are gone. Now, after 10 days, the pustules are gone. And for the first time, Eva looks at me and I can examine her. So a big change in the mental compartment, in the mental behavior. We can see the legs are less red, no pustules, much better. So they did go on with the same doses. And after 10 days, it was getting worse again. That's very good case to explain how to use the LM potencies. If it was getting better, now getting worse again, please, we don't change the remedy. No, we have to reduce the doses. So I said, okay, let's take now 5 drops once a day because she's much better, not take twice a day. And 2 weeks later, 4 weeks after beginning with the remedy, silicea, she is much better. And we reduce now to every second day, the 5 drops. And Eva is fine. And in the next years, from time to time, she had a bit of eczema. And I also gave silicea C30, which was working well. She did need some vaccination. I also gave CDCA C30, which was helping. She did not have any side effects. And yes, was happy. If you have questions for this, we can answer that at the end of the presentation. So let's have the second case. It's a little boy of 3 months old. Diagnosis, infantile eczema. Case history. This little boy has irritations of the skin since the age of 6 months. Every day itching. Examination, eczema in the face with prominence at both cheeks, a rash all over the body. So you see the little boy, all over the body, you have a red rash. Family history, the father has eczema and also pollinosis. And 2 cousins have severe allergic eczema. Symptoms. He likes to take a bath and afterwards the skin is better. Very sensitive to noise, startling, very sensitive. Has perspiration at the palms. It's important to investigate any symptoms with the little babies because normally they don't have so much symptoms. I also always feel the hands, the feet, they are dry, they are wet, they are warm, they are cold. This can give a hint. And this boy has such a nice smile. It's a very friendly baby. If you look at him, he does not know me for the first time, looking at me, very friendly. So if we repertorize, startling from noise, perspiration, hands and palms, likes to be bathing. Eczema does not, you don't have to put in because it's a big rubric, does not help a lot. So we have remedies like Nux vomica, phosphorus, aconite, calcarea. Often in the little babies, we find calcarea, also with the eczemas. But the calcarea babies are much more reserved. They're more slow. They like to lie on the back, you know these things. So I see phosphorus here and that kind of contact and friendliness of that baby. So I decided to give phosphorus and let us see what happened. Phosphorus, LM1, 5 drops twice a day. 2 weeks later, the child is feeling well and content. The eczema reduced clearly. During the day, the itching is much better. And during sleep and in the morning, when waking up, he still has a bit of itching, but only on the scalp. So the case seems better. Now we have to reduce the remedy. Important. If we go on twice a day, they will trigger symptoms. So we reduce to only once a day, 5 drops, which is a low dosage. After 3 weeks, the rash at the body totally disappeared. The face is excellent. In the last day, he again has more itching. So the face is quite good. And now I said, okay, now we have to stop. He's much better. Leave the remedy and see what's happening. 1 week later, much better. So 7 weeks later, the child is very well, only has a bit of itching when hungry or tired. Here's the child, happy. This is not a calcarea child, being so friendly and happy and smiling. Conclusion. Sometimes as a little children, we don't have so many symptoms. So the mental state is very important to differentiate the remedies and the modalities like time of aggravation, influence of temperature, water, food, etc. And this is also very important. So next case, infantile eczema. A boy of 7 months. Since 4 weeks, he developed an eczema at both cheeks. The alimentation is increasing with different food. 7 months, it's a critical time because they're having teething, and they get more food. They're not after 6 months, they're not so much breastfeeded anymore. They get more different food, and this can trigger also the allergies and the eczema. So it seems that apples and carrots are triggering the eczema a bit. And in the evenings and at night, the eczema is more active. During the day, it's getting better. At night, it is itching a lot, and he scratches until it bleeds. So we have clear aggravation at night. Here, this picture is in the morning. You see the eczema at the face, but at night it will be much more difficult. Vaccinations. First vaccinations with 3 months. Afterwards, the boy was crying a lot for 5 days. This was a strong reaction. Second vaccination with 6 months. 1 month later, the eruption started. So most probably it came from the vaccination. And as the family history, all male persons of his father's side have asthma bronchiale, which is a strong miasmatic situation. In the age of 4 months, in summertime with a lot of heat, he developed a red rash all over the body. The skin is very sensitive with heat. He also could think about sulfur. He doesn't like to lay on his back, prefers the abdomen. The modalities are very important. And he has a strong character, throwing things away. So I decided first to give 200. That was given before, but without great effect. And now I decide to give Midorhino. Why? Because we have a miasmatic situation. It is a warm child, likes to lie on the abdomen, and a strong character. So what happens? Follow up. 1 week later, the skin is better, 20%, and the itching, 50%. So first we were giving Midorhino 5 drops every day. Now I said, okay, the child is better every second day only. You see the face. 1 week later, the skin is better and he's sleeping more calmly. Now I said, stop the remedy, because as we know, the nosodes are strong, strong remedies. 1 week later, getting worse again, so we start again with Midorhino once a day, 5 drops. 4 weeks later, the skin is better, little itching, but now he has a terrible bronchitis. So I said, stop the remedy now. Perhaps it's going to the wrong direction. We don't like that. And I did go back to the first interview. I did take the case again. So I remember that during the first contact, this baby had a peculiar way of looking. It was looking very skeptical and was old looking. It was very reserved way of looking at me, not as a phosphorus child I showed you before. So the mother told me that during pregnancy, a neighbor of the family died and the mother was present. And this was a great shock for the mother. So if we repertorize, we see, we take asthma alternating with eruptions. Swelling around the eyes, eruption phase, aggravation night, itching, must scratch until it bleeds, discharge, expression facial, old looking, and reactions after vaccinations. And we have the remedy arsenicum, sulfur, armpis, calcaria, nitricum, acium. So it's a warm child. So we could think about sulfur. But as that incident happened during the pregnancy of a person dying next to the mother, this is more the energy of arsenicum album, which is rare for eczema in little children. So I gave arsenicum album, LM1, 5 drops twice daily because the bronchitis was very severe and the child was little. What happened? Next day, 1 day later, the spastic bronchitis was a bit better, and the eczema started again. After a long time of not having eczema, after one dose of Arsenicum album, bronchitis better, eczema starting again. So we know we are on the good way. Go on with twice a day, 5 drops, Arsenicum album. 1 week later, the bronchitis is much better. And the little eczema at the right cheek is also now getting better, which is due to the healing action of Arsenicum album. So everything is better. We reduce the dose from twice a day to once a day. 6 months later, the child has no infections. Everything is fine. We have to remember that all male persons in his family had allergic asthma. So mathematically, this child was prone to also develop that. And I feel that the medurinum in the beginning was a good remedy, miasmatic remedy, and was helping with the skin, but with the bronchitis coming more strongly. Arsenicum album was doing the following job. Conclusion. This case shows again how strong is the connection between mother and child. We also can induce suppression with a homeopathic remedy. If we go on and go on and go on giving the remedy, the skin is better, the bronchs the lung is worse. This is not the right way, but as we know and stop the remedy, we don't harm our patients. I never see a lot of suppression in my clinic in 30 years. You don't have to be afraid. So, what are the signs of improvement if we talk about eczemas? First of all, the patient has to feel better. The itching will decrease. Wet skin symptoms with discharge, they will get more dry. The redness will decrease and it's more scabbing. Like if we have a sunburn, first we are red, perhaps we have more sunburn in Europe than you in India because our skin is white. So if we have sunburn, our skin turns red, and after 2-3 days, getting more normal, and we have a lot of scabs. This is a good way, good evolution. After redness, we have more scabs. That's no problem. Patients feel more relaxed and they sleep better. I think we have time to have another case, which is also interesting. This is an adult, not a child, and it's a drug-induced autoimmune disease, which is called lupus erythematodes. What is the pathophysiology of lupus erythematodes? It ranges from skin rash, just a second. No. It ranges from skin rash accompanied by extracutaneous stigmata or rapidly progressive multi-organ disease. The diagnosis and subclassification is traditionally based on the correlation of serological and clinical findings. The latter include a photo-induced skin rash, arthralgia, arthritis, fever, Raynaud's phenomena, anemia, leukopenia, nephritis, and central nervous system diseases. So it's a very multi-range pathology. And that is a patient, 44 years old woman, working in the clinic of my colleague. Since 1.5 years, from time to time, she had a bit of redness of the nose. That was not a problem. And in August 93, she had a genital abscess, which was treated with antibiotics and cortisone. Here we see her face again. We see that butterfly redness in the face, which is typical for lupus erythematodes. We see it's not an eczema. We see little pustules, and it's also not a psoriasis, which has more these plaques and these scabs. So in October 94, the pyelonephritis was treated with Bactrim and furadantine for a long time because it was a heavy pyelonephritis. And in the fourth week, taking that allopathic medicament, it started in the face. So, and started strongly. Okay, the complaints were burning pain and itching in the face, better with ice cubes. The general symptoms, the temperature, she's warm, with a tendency to cold hands and cold feet. She likes a lot of sports. She likes swimming, dancing, skiing, very active person. Here in Germany, we do a lot of sports, also the women. And this is also a sign for different remedies. So if we take the rubrics, we have discoloration, redness, the tip of nose, burning pain, pustules in the face. She has had that genitalia abscess and a bad reaction of the antibiotics, of the drugs. So first remedy we see is sulfur, and it makes sense to give sulfur in that case. So here we see her from the side. She's working in the clinic of my colleague and every day receiving patients, and the patients are looking at her face. So this is not a very easy situation for her. So I gave sulfur LM1, 10 drops twice a day, which is a high dosage. 4 days later, 1 day later, already less burning. After 2 days, less production of pustules. So we were happy. I was happy, and we continued twice a day, 10 drops. And we can see the face was getting better. But now more problems came. This is not an easy case. We started with sulfur, okay. In the next week's treatment with sulfur and also Rhus toxicodendron had more or less medium results. It was a bit better, but long away from being cured. We had that stagnation. Yeah. So I had a special idea, and I would like to talk to you about that idea. Because it was clear that after that special antibiotic, which is called furadantine, the skin disorder started. I ordered from my pharmacy potentized furadantine, nitrofuradantine, D30, 1 dose. And what was the effect? This is called isopathy, but sometimes it's helping. So what was the effect? Better, 30%. Now we are going on. Better. You see the face, it's more calm, it's less red, less pustules. But after this dose, still not getting totally good. So what I had to do, I did take the case again. I did go to the first interview. This is a woman who likes to make a lot of sports. She had genital abscesses and she has complaints which are worse before menses. What will be the constitutional remedy? So I was taking again the rubrics. Redness, tip of nose, this was the first symptom. Itching, pimples in the face. Eruptions face worse before menses and abscess genitalia. If we see this, sepia comes to the first part, to the first seat, followed by calcarea, natrium muriaticum. But as this woman is so sportive and likes to move, I did choose sepia. And here I did choose a high potency. Because here really I wanted to see how the power of the 200 will affect the case. So, but here now we have to wait. The first 3 or 4 weeks, we had some up and downs with her. And the 5th week, now it's really getting better. 2 months later, everything is gone after 1 dose of the constitutional remedy of sepia C200. So, as we know from James Taylor Kent, with the C200 in chronic cases, we really have to wait 6 weeks. So, what was interesting in this case for me, and I did like to share that with you, that we also have possibilities with potentized chemical remedies if they did do some harm to the organism, and also with the side effects of vaccinations. Here in Germany, in the Corona time, we had the potentized vaccination of AstraZeneca, of BioNTech, of of Jones vaccinations. And I had the impression that often when the case was having a stagnation, that this nosode of the vaccination was helping. Okay, thank you for your attention. It's always a pleasure. So if there are any questions, I stop here. Okay.
Definitely, it's really a very good presentation. You have shown the beauty of a homeopathy and how it works, and what are the requirements for getting the right remedy. The most important point is observation. You have shown in the pediatric cases that your observations were really brilliant. And that's the reason why you are able to differentiate between calcareous carb and phosphorus in that case, and that phosphorus won the case. And that's the beauty of homeopathy. Another session was another thing was that you're using LM potency so that you are able to minimize the aggravation, or as well as getting the result as quickly as possible. And in the last case also, when there was a standstill, then you find out the reason why there is a standstill, and you are able to find the obstacle in the way of cure, and that finding itself really give you the cure in that case also. So this is how a homeopath need to look into a case, whether it be a case of skin or some other part, whatever may be the case. You have to study the case in details, and you can go ahead with your scientific prescription by way of repertorizing the case. And after repertorization, it is the experience of the person to go whether the medicine which got the highest number of marks, or whether you have to stick on to some other aspect. That is whether it is the temperament of the person, or whether that's why you're able to go to that case phosphorus, because the child was so smiling, having a beautiful smile in the end, and as well as the child was a little bit sluggish, and as you know, the phosphorus patients are a little bit sluggish in that way also. So the temperament that also you considered in that case. So thank you once again, and it's a time for discussion. And those who want to participate in the discussion can raise your hand. And already Rama Devi Ambadi Madam has raised the hand. Am I right, Dr. Beatrice?
Yes, thank you so much. Very well perceived everything, Dr. Danish. Thank you so much. And I'm so happy you are in India, I'm in Germany, but we understand each other very well because homeopathy is combining us, and I'm happy to see that.
Yes, it is up to Dr. Rama Devi Ambadi to say. Yes, please unmute. Oh, sorry. Once again, please unmute. You are, yes. I shall call Dr. Kalyan Saru later.
Hello. Hello.
Hello.
Dr. Beatrice, can you hear me?
Yes, I can hear you, I can see you, and it's nice to see you again.
Okay, after a long time we are seeing, no? Very happy to
Yeah.
see you. Your cases are so fantastic. We could not calculate which is best. All are equally important and very interesting also. Thank you. Thank you a lot,
Thank
Beatrice.
you.
Please come again and again. We are eagerly waiting for your next session. Okay. Thank you.
Mhm.
Thank you a lot.
Thank you.
So it is up to Dr. Kalyan Saru to.
Okay. Okay, sir, I am audible.
Yes, everything fine.
Yes.
Very nice lecture delivered by Dr. Beatrix from Germany. I totally agree with her. A skin disease is not a local disease. You must treat the skin disease according to all the symptoms, totality of the symptoms, and must do the classical homeopathy with the skin disease. Then you can get the cure. You go to the Elensky note, where written in sulfur, when you are going to treat any acute disease, and where there is suppression of the history of suppression of skin disease, you must take the help of sulfur. But when you are going to treat a chronic disease, and where there is suppression of the skin disease, you must help from the sorinum. So a skin disease is not a local disease. Second thing I am telling to you, sir, kindly go to the huge pharmacodynamics books. There is written, a patient is suffering from the asthma of the palm. When you suppress the asthma of the palm, patient must be suffering from the chest complaint, either the tuberculosis, either the asthma, either the chronic bronchitis, must be suffering from that. When the patient is suffering from the palm eczema, and you suppress by the ointment or the alternate other symptoms. Second thing, if a patient is suffering from the eczema of the dorsum of the feet, then you suppress that. Patient must be suppressed from the abdominal trouble, like the chronic dysentery and other trouble. Next, when the patient is suffering from the eczema of the head, at that time you suppress the eczema, must be suffering from the mental trouble, especially the forgetfulness and the other mental troubles comes with the patient. And lastly, I want to say you, if the eczema is present in the genital part of the body, either female or male, you suppress, you take the help of ointment, must be suffering from the sexual debility, sexual weakness. So my suggestion to you, not take the help of ointment in any pathy, either homeopathy or allopathy or other pathy. Never apply to ointment in the skin disease. If you want to cure homeopathy, cure skin disease, try to take the help of homeopathic medicine internally, not externally use the medicine.
That's
and one
right.
thing I am telling to you, sir, one renowned doctor of the Calcutta, Dr. S.P. Day. If you know Bangla, then you can heard the speech of the Dr. S.P. Day of Calcutta, renowned physician and renowned professor of the Calcutta. A skin disease, a lecture of the skin disease, very marvelous denoted by the Dr. S.P. Day. So my request to all homeopaths, we are here, think you don't mind, never apply ointment in the skin disease, then you get cure of the skin disease, either never cure by the ointment. Thank you, sir.
Yes, and one comment, thank you very much. It's a very important point. And you know, I was working years ago in a homeopathic hospital in Germany, and we had patients from all over the country with strong conditions, and they came with a lot of ointment, of course. Ointments. And from the first day, we said, stop the ointment. And we made a special nutrition, which was possible. And the itching was better. And we could leave the ointment, which is the first point. You are totally right. Thank you very much. You're understanding very well. I saw you following the presentation all the time. Thank you very much. And for me, very interesting. You said, if I understood correctly, if the eczema is at the palm, it can go to the lungs.
Yeah, okay.
I did not know this. And if the eczema goes to the intestines, it is before at which part of the body?
Feet, dorsum of the feet affected.
Ah, I will observe and I will tell you my observation. It's new for me. Thank you very much.
It's really a very good observation by Dr. Kalyan Swarup. And that's something, you just added sugar into the cup of tea. That's what we have to say about your comments. Thank if I think Dr. Ramper is also waiting for you. Yes. Unmute.
Thank you, Dr. Dhaneji, or congratulations, Dr. Beatrix, Madam, and Namaskar, Dr. Kalyan Swarup ji. Very nice presentation, excellent session, skin disease. Skin disease, background of psoric in nature. Sura is a very important role of skin disease. Or homeopathic medicine, sulfur. Sulfur medicine, curative way of treatment in skin disease. King of anti-psoric remedy is called name of sulfur. And queen of anti-psoric remedy is called name of Sorinum. So, Dr. Kalyan Swarup ji, I am very agree. No suppression. Skin disease, no ointment. Then cure the skin disease. Suppression and convert other disease, heart trouble, epileptic, and etc. Many kinds of disease. Skin disease and no suppression. Treatment according to holistic and according to symptomological, according to miasmatical, constitutional. So very, very thanks, Dr. Beatrix Gessner ji. Thank you. Very, very thanks.
Thank you, Dr. Ram. Yes.
If anyone want to talk to Dr. Beatrice, please raise your hand. Doctor, what is your opinion on the climate changes in skin conditions? And how will you, do you find any difficulty in those conditions, the climate change in a patient who is undergoing treatment?
Yes, of course. Of course. There are patients when they're at the sea and salty air, they're much better. The climate has a very strong influence. And as we here are in Germany, which are more inside of the country, we have borders with the sea, but we have not a lot of, we have also mountains. Mountains can help and sea can help. And I also would like to say one comment to Dr. Ram. But very important to all of you, the skin disorders are not only psoric, so also be careful with sulfur. Be careful. It can be also in other remedies. And my experience is, if we have a very, very difficult skin disorder to treat, it can be mercury, syphilitic level also. Huh?
Yes, that's a very good answer also. Anyway, it is the time to wind up the session. I invite Dr. Amir Iqbal to say vote of thanks to this session. Dr. Amir, are you there? No. So it's up to Dr. Kalyan Swarup sir to say vote of thanks. Please unmute, sir.
Hello.
Yes,
Many thanks to all homeopaths doctors which is joining here, and especially thank to Dr. Bentis from the Germany. Congratulations, always come and join this seminar, IFPH, to take the decision, to take your mental homeopathic help to us, and homeopathic will also help to us. Thank you, sir. Thank you, madam.
Thank you, Dr. Kalyan Swarup and Dr. Beatrix Gessner and those who attended the session. Anyway, we are very happy to announce that we are celebrating our 4th anniversary on 30th of this month, that is coming Friday. So hope all of you will be there with the presentations tomorrow and will join the celebrations on Friday. Well, thank you all. Good night.
Thank you, Dr. Danish.
It's our to Dr. P. Shaila to moderate the Malayalam session.